I'm Michael Teehan. I'm a psychiatrist. I work in the area of early psychosis here in Nova Scotia, and I also teach at the Dalhousie Department of Psychiatry. What I wanted to talk a little bit about today is an issue that I think anybody who works in mental health is concerned about, and that is the fact that we suffer from a lack of funding, that the resources that are allocated to mental health are considerably less than proportionately are allocated to other parts of the medical field. There's a little story about this that I think illustrates it, or certainly made it very pointed for me. A couple of years ago I attended a presentation by one of our physicians who works in the intensive care unit here in the hospital. It was about another topic, but as a by the way, he mentioned during that presentation a drug that he uses about 20 times a year. This drug, the evidence shows, does slightly improve the chances of survival in people who are critically ill. So there's a rationale for its use. The drug costs about $20,000 each time it's used, and patients who have it administered have to have it done 4 times. So I think you can see that this is a considerable expenditure to achieve excellent care. And I think that is appropriate, and it's the right thing to do in our society. While he was talking and describing this, however, I had a patient that I was seeing and caring for in the community who didn't need that kind of expenditures, but who did need some support. He was being evicted from his apartment in the winter time, had nowhere to go. His illness was such that he was disorganized and he found it difficult to take the steps necessary to find himself a new place. It was our view that he needed support to be able to find a secure place to live and to be made comfortable with some ongoing help to take his medications and so on. The expenditure we're looking for would have been in the order of hundreds of dollars. And our team of dedicated professionals spent many hours, days in fact, trying to coordinate and obtain those few $100s. I do not mean to say that it's one versus the other, that we should not be supporting excellent care in the intensive care unit. What I'm saying is that we should proportionately allocate enough monies so that we can provide similarly excellent care to people who suffer from mental disorders. The outcome of the story is good. We did obtain the money, and that young man is now quite securely housed. His clinical status has vastly improved as a result of having the kind of supports he needs, and it's being done, if not on a shoestring, certainly on a limited budget. I think we need to continue to enhance those budgets so that we can provide the best possible care to that patient and people like him, just as we do in other parts of society for the medically ill otherwise.